So you just started a 510K project with Medical Device Academy, and you're excited to get started with this project. And the first thing that I send you is a device description template. And your jaw drops. Like, I thought they were going to prepare this for me. How come I'm doing all this writing for them? The 510K device description is the central, most important document for our team to have in order to prepare your submission. Without that, we really can't prepare your submission. We need to know what your device is, how it works, what it consists of, what it's made of, how it operates. The FDA needs that information as well. And because we didn't design it, we can't give that to you. Now, exceptions should be, okay, you have a surgical mass. We know what a surgical mass is. We've done a ton of surgical mass submissions. We can probably tell you what it's made out of, but we're not supposed to give you competitors' information. So we can guide you. We can know exactly what we're expecting. We can know what the norms are, but we can't write the document for you. We need to get the information from you. So if you can fill in the blanks and then tell us what things you don't know how to fill in or ask questions, then we can help you, but we can't design your device for you. And we can't do the complete device description for you. If we did that, if you had, let's say, a device description that was from CE marking, and we were going to convert that into our template, we could do that because you're giving us a device description. You're just not giving it to us in the format that we need it in. If it's going to require significant amounts of work, then we're going to have to charge you by the hour for that part. But in general, the first thing we do is give you a device description and ask you to fill that in. And if you have any questions, please ask us. The purpose of this video is to sort of walk you through the different sections of the device description to explain what we need and why it's so important. So the first thing I'm going to do is show you the actual template and start walking you through a couple of the key parts. So here's our device description template. At the top of this, we put your company name replacing our company name. In the brackets, we have your device name. We're going to put your device's name there. And it's a 510K submission. So this is just our header that appears on all the documents in your entire submission. We can fill that in for you. Doesn't matter whether you do it, because we're going to have to do it on all the other documents anyway, and we just do copy paste. No big deal, but that's what we do to the header for this document. There's nothing that you need to do to the footer. It just says it's a device description. It goes in volume 10 of the 510K. It's the first document in that section, and it's pages 1 of 3 of this template. As you add more pages, that number will change. And when we go to the very end of the document, here's the most important thing that you need to do first for this, and we can help you with this. Requirements specific to special controls guidance document. If your device happens to be in a product classification, one of the 3-letter product codes, that has a special controls guidance document, then that's what you should provide information on, because that special controls guidance document will tell you what they want in the device description. So you need to follow that, and you need to follow that line by line. If there is no special controls guidance document, then we're going to use this green text down here. We're going to say there are no applicable product special controls guidance documents applicable to this special subject device. And we're going to delete the yellow text. So all the yellow text is just explaining what we're looking for in this section. That header doesn't go away, just the yellow text does. And if there is no special controls guidance, then we're going to just use this sentence and delete everything else. If there is a special controls guidance document, then that's what you need to follow. That's really important. So if I didn't tell you right up front, yes, there is a special controls guidance document, and here's where it is, and this is the information we're going to need, then you should ask me that question, because I should be able to answer that for you. Sometimes, if we have enough time to, while we're preparing a testing plan or whatever for the company, we'll oftentimes determine whether there is a special controls guidance document. And if there is, we might even put in an outline here, bullet points for each of the things they're looking for. If we've done a previous submission, we may even already have that as a template for that product classification. But this is our generic template, and that's the first question. Is there one? So here, let me show you how you find out. So I'm going to stop sharing that screen and I'm going to share a different screen instead. Let's see here. Google is my friend. So what I'm going to do here is I'm going to type in FDA guidance. And the first link that shows up is search for FDA guidance documents. So I'm going to click on that. And this is the page where you can search for FDA guidance documents. There are lots of ways to search, different drop-down menus, but I have found the easiest way to search for a 510K special controls guidance document is to put in the term 510K, and that finds a lot of ones. And then I will ask for all, and it tells me up here there are 136 out of over 2,000 guidance documents. And when I scroll down here, I'm going to see a lot of these are guidance documents that are not special controls guidance, but this one right here is one for electrosurgical devices. Here's another one for bone anchors. And here's another one for PTA catheters. And I've happened to already have opened up those 3 guidance documents and scrolled to the section that's specific to that. So I will pull up the first one. This one here, if you go to the very top of this document, this one is for the electrosurgical devices, and it's a 2020 guidance document. And when you look at the table of contents, it has a section, device description, begins on page 6. So I go to page 6. Right here is where the device description begins. And they say, this is what you should have for your device description. Part of that's the indication for use. And then for the design, this is what they want. So one of the items is an information about the generator that generates the electrical current to your electrocautery device. Another thing is all the active components. They want to know what those are. Description of the neutral electrodes and the miscellaneous accessories like foot pedals, irrigation pump, suction, smoke evacuation, those items. And then they have some additional guidance here. And this is what I really want to focus on. This section right here, where it says photograph and or drawing of the device. In our template, we actually have a section for photographs and drawings, but people often give me a very crude drawing, maybe a photo of a prototype, maybe a rendering from CAD. We need more than that. So what they say here in this guidance is we recommend you provide high-level drawings, diagrams, and or photographs of this device that help explain the functions and features. We also recommend that you provide an exploded or assembly view diagram or connection diagram, including the components clearly labeled. So like an exploded diagram that labeled each of the components. So elsewhere where you describe what each of those components do, they can refer back to the diagram is really helpful. But that isn't what they have in all the guidance documents. And depending on who the reviewer is, they may want more information or less information. So let me show you another one of the guidance documents. This is the one on bone anchors, and they're asking for completely different information. So instead of beginning with the indication for use, they begin with general suture anchors. They want the length, the inner outer diameter, the material that it's made of. We recommend that you provide drawings or figures for all components with relevant dimensions labeled. If there are multiple bone anchor components, you should provide a description how the components are assembled. So an assembly diagram. If a suture is included in the anchor, you should provide identity and percentages of all materials, including coatings and additives. And they're going to refer you to the USP for sutures, because there's actually a USP requirement for every single suture out there that's used in surgery. And then they have a section on nitinol suture anchors where they ask for additional information, and then polymer absorbable sutures. So 3 different sections here, one for the polymer sutures that are absorbable, one for the nitinol sutures, and one for other sutures, which are the more common. And they've explained what they want. So you need to go through each section of that device description and say, well, it's not a nitinol suture, so that section is not applicable. It's not a polymeric absorbable suture, so that's not applicable. And each of these items, 1A, 1B, 1C, you want to have each of those, and you want to use those numbers and letters to reference what they're asking for. You might even put it in a table. So you might have a row that says, here's what 1A is, and then right below it, you have your information. 1B, and then right below it, you have what your information is. So that way they can see that you've clearly followed the guidance document and provided everything they ask for. When they go through the refusal to accept screening, the RTA screening process the FDA does, they're going to determine, did you do this? And if you miss one single thing, that's an excuse for them to put your submission on hold, reset the review clock to 0 days, and wait for up to 180 days for you to respond. So if we are missing part of that description, we're jeopardizing your submission getting, they wait 14 days, give you an RTA screening letter back saying it was be put on hold. Here's what the deficiencies are. You have 180 days to fix them. We fix the minor thing. We didn't describe that. We add that information. We send it back to them. They restart the clock at 0 days. And 14 days later say, okay, now we'll accept it and we'll start the substantive review. So we just wasted at least 14 days, even if we get a same day turnaround from the day that they tell us what's wrong. And plus I got to send it by FedEx to the FDA. So that's another day. So 15 days. You're going to have delays in this process if you don't follow their guidance. So when they provide a guidance document like this, follow it every single item line by line. That's what you need to do. So this is just the second one that I provided. Here's the third one. This one is for the PTA catheters in the device description section. The first thing it asks for is completely different from the other two. It asks for the components and the mode of operation, including packaging and a clear description of how the device is utilized to achieve the intended use in the intended anatomy. Now, PTA catheters could be used in different parts of the anatomy, so you might have different lengths of catheters used different places. So you might have to describe each version of your catheter. This is how the one catheter works that's 90 centimeters, and this is one that is 50 centimeters, and this is one that's 30 centimeters. Whatever the length of the catheter is, whatever the model is, you might have a different mode of operation for each one and have to describe it separately. Then they want photographs and engineering drawings. We recommend that you provide a photograph as well as engineering drawing with all dimensions, tolerances, and components labeled of the device. Very different from that first one that we looked at where they said it'd be okay to have an exploded diagram that's labeled. This, they want more detail on it. Partly because maybe they consider this a higher risk device. Maybe because some of the details they feel are important and we need those drawings to really see those details. And because every design of catheter is a little different, they can't just tell you that it's going to have that because your device may not have that feature. They also want things about materials because this is probably going to be have extensive biocompatibility testing because it's going to be in contact with blood that's circulating. They're probably going to have to provide a lot more information. So they've asked for what components are non-contacting, which ones are indirect contacting, which ones are direct contacting, what is the type of contact, the duration of contact, what is the material, and if you had any colorants, they'd also want what is the cast number for that colorant. So there's very detailed information that they're asking for in this special control guidance document. We looked at 3 different special controls guidance documents. They look different, all 3 of them, but it gives you a flavor of what you can expect the FDA to want. And there's one more category that I haven't covered yet, and that's software as a medical device. And oh yes, they want a lot of detail there too. It's not enough just to say this is software as a medical device, it's used on a mobile app, and here's what it does. No, they want a lot more for software. So let me show you what you have there. So I'll share my screen here. First, I'll show you what the device description section looks like in the RTA checklist. So when you look in the RTA checklist, it's a document you can download for free from the FDA, and I can send that to you. But in section B of that document, it begins with question 12. The first question that the reviewer has to answer is, the device has a device-specific guidance document, special controls, or requirements in the device-specific classification regulation regarding the device description that is applicable to the subject device. So you answer yes, no, or not applicable. In this case, it was a no. But for other devices, like the last 3 product categories we looked at, it would have been yes. And if it does have a special controls guidance, then you have to provide the information that's in there. The next question is really important. Descriptive information is present and consistent with this within the submission. The device description section is consistent with the device description in the labeling. So you're going to have, if you look at the beginning of our template, and let me switch to our template for a second. Okay, so here's the template, and we go all the way to the beginning of this template. The general description section here is what they're talking about. This general description is typically copied into the 510K summary. It's copied into the executive summary. It's copied into the substantial equivalence comparison. It's also included in the instruction for use for your device, because you have to provide a technical description of your device in the IFU. So whatever description you put here, copy and paste it everywhere else, so it's consistent across the submission, within the submission, they say. So if yours isn't consistent, that's a reason for them rejecting it. So that's what they mean by that particular section. Just copy and paste that first paragraph. But they also want sufficient detail in that section. So here's the next question. Submission includes descriptive information for the device, including the following: a description of the principles of operation or mechanism of action for achieving intended effect. And this was actually checked as a no by a lead reviewer that was looking at software as a medical device. And then in the comment section below, they included all this information for software as a medical device. And the company was not expecting this. And I kept on telling them, we need more information in your device description. They said, no, just submit it. And I said, it's going to get rejected. We're going to get an RTA. No, please submit it. Well, we got exactly what I said we would. We got an RTA. And what it says here is it goes through the boilerplate information that they would normally provide. But then when they get down to when they get right down to the word you here, you mentioned that your device uses deep learning convolution neural networks. Well, that might be great for your marketing materials, but that's not necessarily a good thing for an FDA 510K submission. You want to show how it's the same as some predicate device that didn't have a deep learning convolution neural network. So now you've introduced that this is a deep learning algorithm. You have an AI algorithm in your software, and you're going to have to explain how that works to the FDA and how you're controlling that, and how those technological characteristics don't create new issues of risk that weren't in the predicate device that didn't have a deep learning algorithm. And the FDA says, even though there's no guidance document for AI, these guidance documents below are useful for measurement technology. And so they give you computer-assisted detection software for radiology, and another one on computer-assisted software for radiology. So these 2 guidance documents tell you the kinds of things they're looking for. And this happened to be a radiology software application. So those were relevant guidance documents, even though they weren't specific to that product code. But then down below here, they give us examples of information that they would like to have. And this is really helpful, I think, for a software as a medical device company. If you have software and you have AI algorithms, they want a detailed description of the architecture of your algorithms. So layers, hyperparameters, loss functions, etc. They want pre-processing data, assemble methods, thresholds, size of your data set. So did you train your AI algorithm with 100 data sets, a data set of 500, a data set of 1,000, a data set of 10,000? And then they're also going to want to make sure that that data set was not the same data set that you use for your validation. So you have your training algorithm data set, and then you have your validation data set. And those have to be different. They can't be any overlap. Then they want performance of your algorithm, sensitivity, specificity. Then the next section is details of other non-deep learning methods that you've used. and then details of any post-processing that you do of the data. And then they want you to submit this so they can evaluate whether it's substantially equivalent to the predicate device. So if you've done things very differently to calculate some measurement of the radiologic image, and they're going to want to know, well, even though this is different, does it create new risks, and does it come up with the right answer based on what we know is the right answer? So that's what they're looking for software as a medical device. They want that detail in the device description explaining how you do this. But they also ask for, in the general description at the top there, that one paragraph, you want to give a little bit of information about how this software works, how you develop your algorithm, how you trained it. They want to know if it is learning real time, or whether this is, we used AI algorithms that were learning to develop the algorithm, and then we froze it, and we would release new algorithms over time with revalidation and potentially new 510Ks. And a lot of companies are like, oh no, with our AI algorithm, we planned on updating the algorithm every week, every month. We didn't know we were going to have to submit a new 510K. The FDA doesn't want you to make changes to the device without revalidating it. And if those validations create any new issues of risk, claim any improvement in performance, you're going to have to submit something to the FDA in a 510K. And almost all new algorithm changes require a new 510K, even if it's a small change to your algorithm. So coming up with a rationale for why you don't need to do a 510K probably will not fly. If you make a change to your algorithm, you can almost count on a new 510K. So that describes in general what things we're looking for in the device description. I'm going to have a few more videos explaining other parts of the device description because it's a fairly long document, it's 3 pages long. But the first thing you want to do at the very beginning is make sure, is there a specific device product category guidance document that says this is what we require in your device description, and you have to address that first. If that's a no, then we can put in that default green text and we can provide a more general description based on what we've seen for other devices. But every single section of that template tells you where in the RTA it's asking for that information. If it doesn't say it, it's probably something that I've had the FDA ask for in the past, or it might be something that we've had asked for in CE marking submissions, because we use this exact same template for CE marking submissions in the technical file. So you have one document, you create it once, it can be used for both. The only thing that we would change is the top header indicating it's for CE marking submission instead. I hope that was really helpful to you. Like I said, do what you can to fill in this device description, then put in comments what you're having trouble with, what questions you have, and we'll try to help you. But we do need you to provide at least a description of your device before we can start on it, because otherwise we don't know what you need to validate. We don't know what information needs to be included in the submission if we don't even know the details of how your device works and what it's made of. I hope that was helpful, and thank you. Please don't hesitate to contact us if you have more questions about how to fill in that template. Bye-bye.